Lung cancer continues to be the second most common cause of cancer and the leading cause of cancer death in both men and women in the United States. Most patients diagnosed with lung cancer present with disease that has spread to other areas and cannot be cured. Less than 20% of those diagnosed present with localized, potentially curable disease. Lung cancer has been traditionally classified into two major categories. One, non-small cell lung cancer, which collectively comprises adenocarcinoma, squamous cell carcinoma, and large cell carcinoma, and two, small cell lung cancer, which is more aggressive and has worse survival rates. Approximately 85% of all lung cancers are non-small cell lung cancers. The risk of developing lung cancer is largely driven by age and smoking status. Smoking is estimated to account for 85 to 90% of all lung cancers. Screening means testing for a disease when there are no symptoms or history of that disease. Screening is done to find a disease early when treatment may work better. The only recommended screening test for lung cancer is called a low-dose CT scan, or LDCT. During a low-dose CT scan, you lie on a table and an X-ray machine, the CT scanner, makes detailed images of your lungs. The test takes just a few minutes and is not painful. Who should consider low-dose CT screening? The new recommendations include having a 20-pack-year smoking history, and you currently smoke or have quit within the past 15 years, and you are between the ages of 50 and 80, and you have not had lung cancer and you do not have any signs or symptoms of lung cancer. And let me explain, a pack year of smoking is an average of 1 pack of cigarettes per day for 1 year. For example, a patient could have a 20-pack year smoking history by smoking 1 pack per day for 20 years or 2 packs per day for 10 years. When should screening stop? Yearly low-dose CT lung cancer screening will continue until you turn 81 years old, you have not smoked for 15 or more years, or you develop a health problem that makes you unable to receive treatment if a cancer is found. What are the benefits of low-dose CT screening for lung cancer? The main benefit is that cancers are found earlier, before symptoms occur. By finding cancers earlier, there is a better chance for effective treatment and possible cure. Several studies have demonstrated up to a 20% decrease in death from lung cancer in a screened population. So what are the risks for low-dose CT screening for lung cancer? You can have what is called a false positive test, meaning you have a finding on the CT scan, but it turns out not to be lung cancer. Most of the time, this is resolved by follow-up scans, but occasionally a biopsy will need to be performed to answer the question. Most findings on a low-dose CT scan turn out not to be lung cancer. The second downside is the scan may find a cancer that would not have harmed you over your lifetime. This is called overdiagnosis. At the time of diagnosis, there is no way for your healthcare provider to know if your lung cancer will cause problems over a lifetime. For this reason, almost all people diagnosed with lung cancer will be treated. If you are a smoker and qualify for low-dose CT lung cancer screening, talk to your healthcare provider about getting screened. It could save your life.